And go ahead, Ralph, then Barbara.
Hey, Ralph.
Good evening, Greg. This is a question for a family friend.
Okay.
This lady is 78 years old. She just had back surgery.
Okay.
They had shaved a bulging disc at L1 because
Okay.
she was having back problems. The pain in the spine is gone, but now she's having back spasms. Do we
Yeah.
have an oil that will deal with back spasms?
So, there's several things that will deal with spasms, and you'll have to kind of play with which one. My first go-to
Okay.
for something like this is usually marjoram.
Okay.
Marjoram is very good for loosening up the spine. It's very good for the little spinal muscles, and it's good for those kinds of spasms. And, this is actually kind of common. The issue that causes the pain isn't necessarily the bones or the disc, but the compromised tissue or the compressed nerve around it. And so a lot of
Mm-hmm.
times, even after, the surgery, post-surgical issues are still pain and spasms afterwards.
Okay.
So here's the thing that I would say too, as well, is when you're looking at L1, L2, where there's an issue,
Mm-hmm.
um, you want to rule out that there's a hip issue. And sometimes because the hip is a bit compromised, they don't have pain in the hip, but the gait becomes a little bit abnormal, or they're compensating a little bit.
Mm-hmm.
And there starts to be an issue in L1, L2. And so part of that spasm might not just be that localized area, it might also be the hip. Um,
Okay.
if she
I'll
had an issue in either hip that she's aware of. If not, I would just treat both hips.
mm-hmm.
Um, in the treating of the hips, I would just do like joint relief or rosemary, or something that has
Mm-hmm.
something for circulation and is antispasmodic.
Okay.
You could do even some of the peppers would be good for the hip and the low back area. So kind of what you use on the back, you could use on the hips as well. The issue is you want to increase blood flow to the hips more so than on the back.
Okay.
So like rosemary is a good one just because it won't just linger. It increases circulations, antispasmodic, and moves blood up to the head. So it keeps the blood moving.
Mm-hmm.
So it's a really good one to use on that. But even something like ginger could help.
Uh-huh.
But
Yeah.
basil, petitgrain, and then you can go into like the spikenard, vetiver, roosecouse kind of realm. Petitgrain's always a good one. So I'd say whatever you have handy, like
Yeah.
grab something like that, make it into an ointment, and then start, having her put it on those issues. But marjoram would
Mhm.
be my first go-to one.
Okay. Use we'll think of it in a minute.
I
Sesame oil is a base.
Yes, you could use sesame oil, and if you're going to do marjoram, you can even do alcohol as a base and do it as a body tonic or liniment.
Okay.
So whatever she's more comfortable with, but sesame oil is a very good one to use. I would do
Mm-hmm.
like 20, 25 drops per ounce of whatever carrier you're using.
Okay. 25 drops per ounce.
Yeah, yeah. You're going to want it to be strong. It's not for the whole body, it's for a spot treatment. So
Yeah.
ointments are usually much more potent than like a massage oil.
Mm-hmm.
And so, you know, have her put it on that spot, but be sure to get the hips.
Okay. All
I
right.
given the location and that there's spasms and everything, that's what happens is the hip will cause like a little bit of a misalignment, but a lot of times it's in the gait, like as they
Okay.
walk. And so the disc will get compromised a little bit, like can bulge or wear unevenly, something of that nature.
Yeah.
But the issue is more in the hip.
Okay.
Yeah.
So on the hips, that's directly on the outsides, or should I go
Yeah.
back towards the buttocks a little bit?
I would do on the sides and like the butt cheeks.
Okay.
Yeah.
Hips, sides, and butt cheeks.
Yeah. Yeah. I mean, when you say hips, like you're really wanting to get kind of close into the hip socket, you
Mhm.
know, so it's like if we're going to the butt cheek, it's a little bit lower in the butt cheek, but
Mhm.
usually that whole area can get compromised.
Okay.
So you're really trying to treat the socket, but in doing so, sometimes you have to treat the sides and the whole butt cheek on that one side.
Okay.
Yeah.
All right.
If you're not sure, treat them both.
Yep.
Yeah.
Well, at this point, I didn't see the X-rays and all, so I'll just slather it up.
I mean, sometimes like when they've gone through and do the surgery,
Mm-hmm.
sometimes the surgeon will look for the hip socket issue, and
Mhm.
sometimes they won't. You know, it
Okay.
depends on their specialty. Like sometimes spinal guys are just spinal guys. They don't really venture out into the hips and all that. They'll send that off to somebody else.
Mm-hmm.
And then you have like an orthopedic guy where he's looking for structural things that can contribute. And so um you know, I would say a good chance that if she had it, they would have caught it, but you never know. Like you just never know. And
Okay.
bottom line, you're not hurting anything by treating it. In fact, you're kind of stabilizing the spine a little bit more so. Um, you can always do a little bit of you know, digestive calm on the
Mm-hmm.
front, you know, on the abdomen, just
Yeah.
because it will have uh like a like like a relaxing effect on the fascia, but it
Mm-hmm.
is will help to release the fascia a bit, but it will contribute into the psoas. And I mean, if it's really significant, you can use probably like just hyssop, but you could use hyssop and then rotate between hyssop and helichrysum, and
Mm-hmm.
have her inhale with her awareness on the perineum, or like with pH, just clean that perineum like nobody's business. And
Okay.
the issue is it takes some of the tension out of the spine, but um by cleaning up the perineum, you're relaxing the legs and the hips, and you're relaxing the psoas. And
Okay.
by doing that, that takes pressure off the spine, off the low
Mhm.
spine.
Okay. So I'm going to rotate inhaling hyssop and helichrysum with attention on where?
The perineum or perineum, however you want to say
Okay.
it.
All right.
Yeah.
Perineum.
In
Okay.
Pranikili, we say perineum, but
Yeah. Well,
medically, they usually say perineum.
no problem.
It just
Used to be.
depends on what part of the world you're from. You know what
Yep.
I mean?
Oh yeah. Yeah. I used to work in Silicon Valley with an international
Right.
work team around me. I know
Yeah.
what you mean about what part of the world you're in.
Yeah.
Okay. Cool.
So,
Excellent.
and
Thank
then
you.
questions about that, you just let us know. Like, you know,
Yeah.
send
Well,
an
I'll
email or
run it,
something,
and
but
then
that's
if yeah, I'll run it, and if I don't get good results, I'll come back and ask some more questions.
okay. Good,
Thanks.
good.